Hi, Dr. Jim Jameson here today to talk with you about topics in joint replacement surgery. Today we're going to talk about what happens after your surgery. When you come out of the operating room, you'll have a dressing over your incision that's called an Aquacell dressing. We use these in both our hip and knee replacement patients. These dressings are waterproof. They seal completely around your incision and allow you to get into the shower. We leave those in place for a week, so the 7th day after surgery, you can take that dressing off, leave the incision open to air, and you continue with your activities, showering, and everything else after that. You'll have little paper strips across the incision called steri-strips, and they will gradually come off over time. One big issue after joint replacement surgery that patients are often concerned about is swelling. Everybody gets swelling after their joint replacement. Some get more than others, but everybody gets some. I have all my patients wear compression stockings on their legs after their surgery. Swelling typically increases during the day the more you're up. Sitting in a chair counts as being up. If you find that your leg is getting tight and uncomfortable, even with the compression stockings in place, the thing to do is to go lay down so that your back is down pretty flat and your feet are elevated with your feet up higher than your shoulders. So if you've been up for a few hours, your leg's getting tight and uncomfortable, go lay down, take a little rest, elevate those feet. That'll help keep swelling under control. Then get up and get moving again. Elevate a little later on if you need to. Swelling should be a little better in the morning when you get up than it was the night before when you went to bed at the end of the day. And over time, gradually swelling will return back to where it was prior to your surgery. It's very important that you get up and get moving. We'll have you up the day of surgery, out in the hallway, moving along, doing stairs. A lot of patients are ready to go home the day after surgery. In some special situations, patients may even be ready to go home day of surgery or within 23 hours, and we can talk about that. When you do go home, we'll have you set up with home physical therapy, but they'll come to the house just a couple times a week. It's also important you do your exercises 2 to 3 times a day to be sure you're having a good, safe, and active recovery. Generally, recovery time is in the range of 4 to 6 weeks to move along from a walker to a cane to no device to driving, going to outpatient therapy, and gradually getting off your pain medicine. Those are the main issues with the immediate recovery after joint replacement. Thanks for joining me. We'll be back next time with another topic in joint replacement surgery.